In today's episode, we're going to be talking about 100% case acceptance. And you might be thinking, Gary, that's not possible. Well, the way you're thinking about it, it isn't possible. But the way I'm going to describe it and the paradigm shift that I'm going to present to you is totally possible. And it's going to alleviate a lot of the stress that you have and your team has. And it's going to alleviate pressure from your systems and your processes when you begin to think about case acceptance this way. So you're going to want to stay tuned for this one. Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want, but you will never grow if you don't figure out case acceptance. It's one of the biggest thorns in the side of all marketing. I was recently just in a marketing, in a Facebook group, and someone asked the question, what is my ROI going to be on marketing? And it's like, dude, that depends, right? That depends. How good are you at presenting treatment? That's where the rubber really meets the road when it comes to ROI in your marketing. And so today I want to talk through 100% case acceptance. Now, I want to give credit where credit is due. This framework that I'm going to present to you is 100% not mine. I learned it from the late, great Greg Stanley, who recently passed away earlier this year, and it was a huge loss to the dental industry because Greg was awesome, and Greg is awesome. And I actually learned a ton from him. He's touched so many dentists in the dental industry and was an amazing dental consultant. Now, when I first got into dental, I didn't know anything about dentistry or anything. I was just totally noob, and he was so kind to me and helped me understand so many things. And a lot now when I interact with people about dental marketing, because now I kind of understand how difficult it is and the complexities, I try to approach it with the same attitude and spirit that Greg had because of who he was. Now, one of his courses that he taught, and I'm not going to be anywhere as eloquent or as good as he explained it, but one of the courses that he taught was 100% case acceptance. Now, here's how he presented it. And when I understood this, it was such a game changer to me, okay? And I would love for you to drop down below. Is this something that you are interested in learning more about? Because if so, I'm thinking about creating a whole course around this, 100% case acceptance. So what he explained is this. When a patient comes into your office, especially from marketing, and they accept any kind of treatment, even treatment from, let's say, like their chief concern, right? They come in, ow, my tooth hurts. Oh, my tooth just fell out. I need your help. Or, oh, my tooth just chipped. Okay? So they come in. The first thing you're going to do is you're going to address the chief concern. Hey, let's get that taken care of. And as long as you get that treatment done and you accomplish that treatment that they came in concerned about, and or they schedule their next hygiene appointment, over the lifetime of that patient, and we're just talking about one patient now, okay? You are going to get 100% of all the treatment from that patient. Okay, I want you to think about that. So the average patient's going to spend, I've heard tons of different numbers on this, but let's just say over the lifetime they're going to spend with your office, they stay with your office for 7 years, and they're going to spend an average of, $2,000 to $3,000 a year. So we're talking about $20,000 to $40,000 over the lifetime with your office, right? Something like that. You are either going to get all of that or you're going to get none of it. If they stay with your office and all they have to do is address the chief concern and schedule the next hygiene appointment, you will get all of that treatment. All of it. Because they're just going to keep coming back and, we got to fix this filling, and we got to do this crown, and you want aligners, and what you need an implant, whatever it may be, right? All the way down the line, the whole life of that patient. Now, if you don't keep that patient, they don't schedule their next hygiene appointment, they don't get their chief concern and why they came in taken care of, what happens then? You get 0% of their treatment. Now, here's where the real kicker comes in. If you can figure out how to make sure that one patient stays with your office, not only do you get 100% of their treatment, you also get a patient referral or two every single year from them. So every year, they're going to send 1 or 2 people in. So now you're getting that 100% treatment from that patient, plus you're getting a referral here and there from them that are also going to stay with your office because they were referred because the patient loved you so much and they said how great you were. So they refer them in and they stay with your office. And over time, what happens is that snowball effect starts to happen with just that one patient. So you get all of that treatment and you get all the future patient referrals. Or you get nothing and you get no patient referrals and you get no treatment on that one patient. Now, once you understand that concept, then you say, okay, well, now I got 10 new patients. It's the same exact thing. So with 10 patients, your goal should be, I want to keep 8 of them. I want to keep 9 of them, or I want to keep 10, whatever, right? And how you measure that is, did they get their chief concern addressed? And did they schedule their next hygiene appointment? If the answer is yes, 100% case acceptance over the life of that patient. You get all the treatment that they ever need. They're going to come right to you. And you get the referrals. Now, instead of 1 or 2 a year, now you're getting 10 to 20 a year from that group of 10. And then guess what happens? The month resets and then you get 10 more new patients. And guess what you get there? Another opportunity. When you begin to look at case acceptance in the way we traditionally look at it, where we say, okay, we presented $100,000 worth of treatment over these patients and this percentage was accepted, you lose the nuance of what you're actually trying to do because you're too deep in the numbers and you're not deep enough into the people. Does that make sense? So this concept really begins to challenge the way that you think about case acceptance, and it begins to change the way you treat people and how you're having conversations with them, because now you're not trying to do a ton of treatment. Now you say, well, what if they come in and they're in pain? That's your chief concern, but they got a lot of work that needs to be done. You just ask them, hey, I know you want to get this. You came in for your tooth today because you're in pain, and I know you want to get that taken care of. Is that, if I notice any other work that needs to be done, would you like me to bring that up to you? Or you want me to just deal with this problem and then we'll deal with the rest later? That's it. Or at the end say, hey, I noticed there were some things going on in there. Would you like me to share those with you? And I already know what you're thinking, Dennis. Well, you got to chart it. You got to record it, all that kind of stuff, right? But if the patient doesn't want to hear about it, they don't want to hear about it. You're earning their trust, right? And so you're giving them the option to learn more about it. Most people are going to say, yeah, I would love to know more about it. Well, here's what we're seeing. Boom, 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 boom. So let's get your chief concern taken care of, and then you can let me know if you want to take care of these other things and learn more about them. That's it. Very simple. And guess what? Everybody's happy. Patient's happy. You're happy. Your team's happy. It removes all the stress of like your percentages and your revenue. All that disappears when you begin to think this way. So I would love your thoughts. Am I crazy? Am I right? Is this a new way of thinking? Has it changed your mind at all? Or is the way you're doing it better? I would love to hear your thoughts on this one. Comment below. Look forward to hearing from you soon.